Pain Point Doctor-Patient Relationship Series. Number 7, being misdiagnosed. So this particular patient that I took down the note, she says, I can't keep living like that, but no one seems to deal with it or believe me. So this is a tough one, right? When you talk about being misdiagnosed. The reason why I say this is such a challenge here is, look, being a physician is a challenging job, right? We spend a better part of a decade educating ourselves and doing our best to make the best decisions and so forth for you. We all go through residencies, which is really important when you talk about medical doctors, right? We go through residencies and they're grueling. I went through a very grueling one in Columbia, New York Presbyterian. And so, but it prepares you. It prepares you to hopefully avoid what can be misdiagnosis or what have you. And so I'll talk around misdiagnosis in a little bit of a different way because, you know, misdiagnosis is a little bit different than kind of getting to the root of the problem. For instance, patient that I saw, and the patient's kidney function was elevated, everyone. And when you look on a blood test, guys, you'll see a word creatinine. Creatinine is, and it's different than creatine for you workout buffs, all right? But creatinine is a measure that we use to check the function of your kidney. So this isn't necessarily a misdiagnosis story, but I want you to understand what may feel like that until we get more information. So have a patient's creatinine is elevated. You don't want that particular measurement to be elevated. You want it to be within a nice little range. Now, there's a lot of different things that can cause an elevation in your kidney function or your creatinine. It can be pre-renal, we call it. In other words, there may not be enough liquid getting to the kidney to perfuse it, so therefore your kidney is dry, the number goes up. There can be a problem or a disease with the kidney itself. You know, the kidney has these little sections in it. Some of them can be diseased, or whether it be by your body from autoimmunity, whether it be from infection, whether it be from taking too many NSAIDs like ibuprofen, Motrin, and that kind of thing. And then it can also be outside the kidney, like the tubules of the kidney can be a little bit off. So the reason why I say that, for instance, with this elevated creatinine, what if I told this patient, oh, I don't think you're drinking enough, and that's why your creatinine is elevated, and I want to do something about it. And so that's not the actual misdiagnosis, because I'm getting more information, right? I'm going to check other blood tests and see if she appears dry. I'm going to do an ultrasound to see if there's something wrong with the kidney. I can also do an ultrasound of the tubules to see if that's the problem. So some of this is us trying to gather more information to find the right diagnosis. That's the way at least I go about it, systematically like that. Now, there are situations, unfortunately, like this patient, and I didn't get a chance to ask her like what was misdiagnosed for her, but you know, some of these things kind of happen, but I think that they're reduced when, number one, you have a great relationship with your doctor, so they really can get into exactly what makes you tick, exactly what your symptoms are, what brought them on, what made them worse, what made them better. All of those things, providing more information, which is the root of what I'm getting to. Providing more information helps to decrease misdiagnosis. Providing more information paired with having a better patient-doctor relationship and bond together really helps misdiagnosis sort of plummet. Now, this patient sounds like she has unfortunately dealt with this a bunch of times, and that, you know, that gets me to another kind of challenge with those healthcare disparities that we talk about, which I saw, you know, diagnosis challenges and so forth that maybe didn't make the most sense sometimes, with areas where care were in areas that were maybe as affluent or what have you, and so the level of training around them can be a little bit different as well. But I'm here to say the same tenets should be there, whether you're whether those patients are in an affluent area or not. It still should have been about having a good relationship with your doctor and making sure that you educated the patient as much as possible and got to know who they are. So I'll tell you this, If you have unfortunately been affected by a diagnosis that's off or what have you, remember there is some fact finding that needs to happen. And then if it really is truly a misdiagnosis and so forth, obviously that's a discussion to have with your doctor and with your family about, like, how did this happen? How do we keep this from occurring again? But the point is I promise you, the best way to decrease that is asking questions, being open with the doctor, telling them everything that's going on, and not holding back anything along the way as well. And if I didn't say it, making sure that you have the perfect patient-doctor relationship really helps that as well. Hey everybody, Dr. Ken Redcross here. If you don't know, I love the patient-doctor relationship. It is so important. So my question for you is, who wants to live longer? We all do, right? So therefore I've written 2 books. This first book is called Bond. It's the importance of trust, respect, empathy, and communication with your doctor, because I believe if the relationship is perfect, then it will help you live longer. But how can I really make sure you live longer? Well, I decided to write a second book. This is the 15-minute Bond Blueprint. This particular book helps you go minute by minute of your 15-minute visit to make sure you get the perfect doctor relationship and visit that you all deserve to make sure we extend our healthcare journey.